ready?
Yeah, I guess so.
Okay. Hello and welcome back to the KCCMH Connection podcast. Today, my guest is from the Parke Health Clinic, Jessie Smith, family nurse practitioner.
Good morning.
Yeah. So for our listeners, Jessie, can you tell us, just introduce yourself and tell us what brought you into healthcare?
Sure. So my name is Jessie Smith. I'm a board certified family nurse practitioner. I work at Parke Health full time. I've been here since 2018. I didn't grow up in Burlington. I actually moved here from Cheyenne Wells, but I'm born and raised in Colorado. I grew up in Northwest Colorado by Craig. And healthcare, it's pretty interesting. So I started my career as a nurse and, just kind of progressed through it and became a nurse practitioner and just, I was the director of nursing and just realized that, you don't really get that patient access when you're in administration. And I miss that.
Mm-hmm.
And so this is a good way to really affect change in patients, that you can't really do any other way. And it's amazing. This is the best job I've ever had. And I've had a lot.
Where did you go to nursing school?
So, a lot of places. So I started as an LPN and I was an LPN for several years and I did that from Community College of Denver, because I was living in Denver at the time. And then I started in Cheyenne Wells. That was my first job. And then I got my RN from Lamar Community College. And then I got my bachelor's degree from basically an online school while I was living in Cheyenne Wells. And then I got my master's and my nurse practitioner from Regis University in Denver.
Nice.
So kind of a comedy of schools there and different things.
Yeah, but I'm glad you can highlight those because I think it's important that people know that they can become a nurse through a community college, and that the same through online schools is that I think they're underknown resources for people that want to get into healthcare.
So I kind of preemptively, your next question really kind of struck me. What inspired me to become a nurse practitioner?
Yeah.
So I think kind of one of the things that happens is, I don't really know how you say it, but really nurses kind of get misinformed. So a lot of times when you hear nurses talk about like, well, why'd you become a nurse? And it's always about like, well, I wanted to care for people. I wanted to, I saw how nurses took care of my grandma. I saw how nurses did this, and I wanted to be able to care for people. And that's a really big part of the job, but there's so much more to it. And I think one of the things I really think about for me was I got into nursing because of the availability. You can be a nurse anywhere and, you can do so many different things with nursing, and it's a good job.
Yeah.
It's a nice paycheck. You do get to see lots of different things, but I think some people don't go into nursing because they don't feel like they care enough, because everyone's like, oh, well, I don't know, because, just deep down in my heart, I care. And I think that's really true. But also, so much of this job is really charting, but it is taking care of patients. And that's a really big part of it. And that's awesome. And nurses do a really good job with that. So I do think that's important, but it's a great job. And there's so many things you can do. I mean, you can be a med-surg nurse, an ER nurse. You can do forensic nursing. You can do administration. There's so many things you can do. And I think people are reluctant to get into nursing because of this stigma of what it is. And they maybe like don't think, oh, I don't care enough to do that. You see what I'm saying?
Yeah.
And it really isn't like, once you get into it and you realize that the caring comes naturally because you're taking care of people. And sometimes you take care of them on their worst day ever, and you get to be there for them and you get to see that and you get to help them. And that's pretty amazing. But it's not as hard as I think some people think it is.
Gotcha.
And I will tell you, like, when I started in Cheyenne Wells, I mean, I really worked with some of the best nurses. I mean, they really inspired me to go farther and do more. They know who they are, but it was really great. You see rural nursing and you see kind of how you really are kind of on your own a little bit,
Mm-hmm.
and less so here. I think there's a lot more staff here for sure, but you do get a chance to see everything. And it's not just like, you're not just stuck in one position or doing one thing. And so just really kind of expanding your knowledge and being able to access that stuff, I think has been great. And so nursing for me has been, and it's funny, I got into it because of, you can do this job anywhere. And I've only worked on the eastern side of the state.
So that kind of makes me think of another question is that, you're inspired by your mentors. Do you get a chance to mentor others?
I do, actually, yes. So now as a nurse practitioner, I mentor other nurse practitioners, mostly from people who are wanting to become nurse practitioners in our area. And so that's been really great. I do think about the importance of education. And at some point, I would like to transition into more of like an educational role to teach future nurses. I just haven't quite got there yet because I really do love my job and I don't want to be like, well, I don't want to make that transition yet. But someday I would like to get into that field because I do think that nurse educators there's just not enough of them.
That's true.
And so I think that, and I think having the clinical background that I was able to obtain from working in rural healthcare that you really don't get working anywhere else would be a really great asset to that.
That's awesome. Well, I think besides nursing, teaching is pretty great profession. So I hope that works out for you someday. So can you tell us what a typical day looks like for a NP in a rural community?
Yeah, so there isn't a typical day. Every day is going to be different. And that's pretty true with like any kind of nursing, but any day is different. So my day starts early. I generally am in the office between 7 and 7:30. Clinic opens at 8, and just trying to organize my day, figuring out what patients are scheduled, going through labs and imaging and calling patients back and just trying to make sure that everyone's been taken care of. And then the day starts with seeing patients and it's boots on the ground, right? So you work with your staff, which we have an amazing staff at Parke Health between, the girls up front who are, registering and organizing calls and doing that stuff. And RMAs have been really awesome. And they're so integral in the whole process of making sure that patients are being taken care of and doing all that. And then you're just seeing them and you're just seeing patients. And one of the nice things about here is you get to actually look at patients as people where I hear patients who go to like city clinics and they had to wait a long time to get an appointment. They didn't feel like they were listened to. And so I don't think we have that here. And I think you get to know your patients a little bit better here because you know them, you see them. People catch me at the store and they're like, hey, can you, I was wondering about this lab, whatever. And with HIP and stuff, I'm like, just call the office or let's make an appointment and talk about it. The soup aisle is not the place to talk about your chronic conditions. And then, at the end of my day, it's just finishing up, right? Calling patients back, making sure that charts are done and that. The type of patients we see, like Dr. Pimentel and we talk pretty frequently, but one of the things is it seems like our patients are becoming more complex. And I don't really know that necessarily that's true, but I think more that we're paying attention, patients they're being more open with us. And so we're really getting into more of their other problems other than just, your blood pressure or your whatever.
So like trying to find the root cause as opposed to just putting a Band-Aid on the problem.
That and also more mental health. We're seeing, which it's always been there.
Yeah.
But I think we're seeing a lot more of that coming out. I think people are being more open about it and about asking for help where before, having those conversations is always difficult. It's like, how do you ask someone, besides like, are you feeling suicidal or homicidal, right? Those are pretty drastic. And sometimes it's really just like, I just don't feel like I enjoy my day. I don't feel like I feel like it could be better. And a lot of times patients talk about, there's like, this is just how it's supposed to be. And because people don't talk to each other about it, they assume that you're the only one that's dealing with it, and no one tells you that, people are at their regular jobs and they're not like, hey, Eileen, do you just feel like every day just kind of one day leads to the next? They don't talk about that because they think it's their own problem. And really it's not. And I think having that conversation, with your provider is so important because we do really kind of miss that sometimes. Cause we talked about before we started, you talked about the short duration of time providers actually get to talk with patients. And it's like with the way things work, you just don't get access to that information as often or as much. And we are working with that at Parke Health. We're actually instigating a new program to really kind of trigger that more so that we can have an open conversation with people about their mental health a little bit, and realizing that it doesn't have to be so drastic to ask for help. So
Yeah, and we do offer some mental health
we do.
services. We have a licensed clinical social worker, and so it's not probably as a robust program as what's needed, but if you do need help or think like there's just more to it, you can call Park and schedule an appointment with Krista Davis.
And she works at Parke Health and Stratton.
Yes.
So she does both places. And she's amazing. Patients really like her. They connect with her really easy. She's really easy to talk to. And she's also a great resource. We use her a lot for that. Like I use her. In fact, I used her yesterday because I needed help with a patient. So
But I'm really glad you brought that up, because I do know that there has been a lot of stigma around mental health, and there still is, but I do feel like the veil's kind of starting to be pulled back, and that people realize that it's okay to ask for help, and that there are resources, and you just got to ask for help if you need them.
And there's a lot more resources now than there used to be,
Mhm.
because I think people are starting to pay attention to that. Now we just got to get insurance to pay for it.
Well, that's another
Yeah.
podcast.
I think that's more than just a podcast, but
Yes.
yeah. Okay.
So what types of patients or conditions do you most commonly see?
So again, you just never know what's going to walk in the door.
Mm-hmm.
But I would say around here, most of the patients that I see are hypertension, which I'd like to talk a little bit more about later. We see a lot of that. We see like congestive heart failure or heart failure in general. We see a lot of COPD and asthma,
Mm-hmm.
allergies, especially around here, where I think in other areas you just don't have that as much as out here with all the dust and stuff. I think that really triggers that. We see a lot of just everything, right? But it's a lot of cardiovascular, pulmonary, heart and lung stuff.
Chronic conditions.
A lot of chronic conditions. Of course we have, ortho and injury and, those kinds of things, but
How did the cold and flu season treat you this year?
Honestly, it wasn't as many, I feel like, as we have in the past, but it was worse this year. I think patients were sicker than they usually get with flu, especially. I think this year, which I'm not sure what the deal was, but I think this year less people got their flu shot. And those people tend to be so much sicker than if they had gotten their flu vaccine, which big thing. We really wish you would get that. And then, and of course, it usually we kind of go through seasons where it's like, oh, well, right now it's RSV, and right now it's strep, and right now and of course, the start of school is always Petri dish stuff.
Yeah, the
Everyone
funk, I call it.
But this year it was really kind of just like a common mix. Like we were having flu early, and, we had RSV through, and of course, COVID, it goes up and down, but that's still around, and we still take care of that. And, but yeah, it's just kind of been different this year.
Yeah, that's what I think. When Elizabeth was on, we talked about how the flu was just hitting people so hard this year. There was a lot more admissions to the ER for the flu than in recent years.
And I think it's because when you get it as bad as people have been getting it this year, you really just think there's got to be something else wrong with me.
Yeah, because it's just knocking you down.
This just can't be just the flu, because you just feel so awful. You feel like you're missing something.
Yeah.
And of course, we want you to get checked out, right? We want you to be seen, right? We'd rather make sure that we're not missing something, but yeah, it has been pretty rough this year.
So what challenges do rural patients face when it comes to access, chronic disease, or preventative care?
So much. So first of all, I think Carson County Hospital District does a really good job of having access to providers. Between Parke Health and Stratton, we have 6 providers. We have 2 physicians and 4 nurse practitioners. And then, of course, all of the ER staff with the TNT group, which I know you guys have talked about before, and you've had EMS on already. But, really, I think the biggest thing that people have a hard time with here is specialty care and advanced care like surgeries and those kinds of things. And I think, Kit Carson does a nice job of working on getting specialty clinic providers in here and doing that. I think that's always a tough thing. It's always hard to find because you don't just want anyone, right? I mean, you could find a cardiologist to come out here, but you don't want just any cardiologist, right? You want someone who understands rural healthcare. You want somebody
Mhm.
who understands that it is a little bit different. And you want someone that is nice, because patients will come in and see me and they've gone to Ray, or they've gone to Goodland, or they've gone somewhere else, and they saw a specialist and they were like, they didn't talk to me. They walked in and looked at me, and that was it. They didn't touch me. They didn't explain anything.
And our patients are used to that.
But yeah, I think our specialty clinic providers do that. They go in and they talk to them and say, hey, look, explain what's going on and give them next steps. And then also they write really good notes so that when they come and see me, I can follow up and kind of keep track of that as well.
Yeah.
And so we can do that collaborative care. But really it's access to those things. I think that's the biggest thing with rural care, not just here, but at every rural hospital. And I think it's such a struggle. And I think it needs to be so collaborative with larger hospitals and just kind of getting that. But that's it. Transportation. Transportation is a really big one.
Yes.
I have patients who they need to see a specialist and don't have a car, or their car is not ready to go on the highway.
Yeah.
So that becomes an issue too. And just trying to manage that can be tough.
Yeah, I know that's one of the social determinants of health that the foundation hopes to work on is access to transportation, at least locally, for specialty and primary care visits. So that's very cool. So, can you tell us what are some misconceptions people have about nurse practitioners or just primary care in general?
Sure. So I think the biggest misconception about nurse practitioners is that they don't really know what we can do. For instance, so we have a lot of Spanish speaking patients, and there's no word for nurse practitioner. And so, when you make that translation, it sounds like you're a nurse.
Mhm.
And we are absolutely nurses through and through. This is where we started. This is where we got our experience. But as a nurse practitioner, we can do almost everything that a physician can do, in primary care. So we can diagnose, we can treat, we collaborate. We can, really spend time with you, and really kind of talk about maybe some things that you didn't realize was bothering you.
Mhm.
And so that's probably the biggest misconception is I think patients think that nurse practitioners are less than, and so they won't schedule with us because they just,
Oh, I need to see a doctor.
yes.
Yeah.
And we do get that. We
Mhm.
do get that. But then once patients come and see us, they're like, okay, but that's kind of been a hurdle. And then there's always been that nurse practitioner, physician assistant line.
Yeah, which honestly, I don't understand.
So we're basically the same. It's just how we got here is different.
Okay.
So there's some legal things that go along with that, but that is those walls for PAs are going away, which is great. So they can practice independently. Where in the state of Colorado, nurse practitioners have always been able to practice independently, so we don't need a physician oversight. We don't, and so, but that's changing for PAs as well. And I don't actually know exactly what that's changing to, but I know that they've made some progress with that as well. But really, we kind of all do the same thing. As a nurse practitioner, we can work in cardiology, we can work in all the specialties. It's just where your education is at. And that's the same thing with PAs. They can work in any specialty. They just need to have the education to do that. And I know, for here right now, it seems like we have a really big divide between nurse practitioners in the clinic and PAs in the ER. But even there are nurse practitioners who work in the PR, or nurse practitioners who work in the ER and as inpatients, and they're amazing. So I do think that they kind of get we're talking about starting nursing. They kind of get the leg up because their title is physician assistant.
Yeah.
And so I think patients think that they're better. And they're not. I mean, we're basically all the same.
Yeah.
So
Cool. Well, I'm glad you could explain that to us because I do think it's a misconception. So, how do you help patients feel empowered to take charge of their own health?
So I love this. This was actually a really great question. So one of the things I always tell my patients is you're in charge of your healthcare. We do what you want to do, right? If someone comes in and I'm like, hey, you need to start a cholesterol medicine. And they're like, no, I don't want to do that. Okay, let's talk about it, right? What's your reasoning? And sometimes it'll be like, oh, well, I heard it causes this. Well, that's not true. But you always have the power to say no. You always have the power to say, I don't want to do that, or I'd rather do this, or can we try this instead? And as long as it makes sense and it's safe, we can do that. I think that's one of the things that patients kind of struggle with is because they don't want to talk about things because they think they're going to be forced to do something they don't want to do.
Take medicine.
Yeah, take medicines, get scopes, right? Getting colonoscopy, right? So, real quick, we'll talk about colonoscopies because there's such a stigma about them.
Mm-hmm.
And if you've ever had one or heard from people, they talk about, drinking that big jug of stuff,
Yeah.
right? And I truly think that gives patients PTSD because it can be so just difficult to do. And one, you don't have to do that. I mean, we don't do that here. Here it really is, you take a couple pills and drink a Gatorade. It's so easy to do. And even patients who did it the old way, they'll tell you the colonoscopy part itself, super easy. You're in and out in an hour. It's really easy. You have to take the day off of work, but the procedure itself is really easy. It's just the prep was so scary.
Mm-hmm.
And I think that, like, when I talk to patients about doing that, when we talk about that preventative care for colorectal cancer screenings, they're like, oh, I don't want to drink this stuff. I was like, okay, but that's not true anymore. And so those kinds of things, the misconception. Also, I wanted to talk about.
But first, who needs a colonoscopy?
Oh, so that's great. That's one of those big preventative care things. Really, the new recommendation the new recommendation for colonoscopies or colorectal cancer screenings in general is to start at 45. Now, this has changed because even just a few years ago, the recommendation was 50.
Oh, wow.
And there was a big study done at UC Health. I think it was UC Health with Mrs. Dwyer. She's from Cheyenne Wells, actually. She actually is a very big part of that study. And they found that really because of, and I don't really know the reasons. I think it's probably because of our diet from the last 30, 40 years,
Mhm.
that colorectal cancer is happening sooner. And so really the recommendation started at 45. And then as long as it's clear, it's every 10 years. Really easy. If they find anything, then the recommendation can change and then kind of go from there. Something else that we don't really talk about with that when you think about colon screenings, it's always colonoscopies. And there are other options. So we can do, there's a big fancy term for it, but it's basically the Cologuard.
Mm-hmm.
You probably see the ads on TV where they send you a box, you get them a sample, you send it in. The colonoscopy is the gold standard, right? It's the most accurate, best way to look at things, absolutely. But for patients who, one, don't have time to do a colonoscopy or they're just absolutely against it, the Cologuard is a nice option. And the recommendation, as long as everything is fine, is every 3 years.
Oh, wow. So 3 years for Cologuard, 10 years for a colonoscopy? Well, that's not crazy.
Yeah.
So your PSA of the day, if you're approaching 45 or around that age, schedule your colonoscopy or talk to your primary care provider about it because it can catch things early and keep something from really becoming a big issue later in life.
Yeah.
Okay, so how are there particular health trends that you're noticing in our community right now?
So not just in our community, but the things we see really, and I kind of harp on this a little bit, blood pressure is such an indicator for just general. But the problem with blood pressure is you don't know you have high blood pressure. You don't feel it. You don't have any outward signs. You don't know you have it unless you're checking it. But that's why they call it the silent killer,
Mm-hmm.
right? Because even though you don't feel it, it is causing damage. And that damage catches up to you when you're 50s and 60s with heart attacks, strokes, cardiovascular disease, those kinds of things. And so, really, the recommendation is getting in and getting that screening done, checking those blood pressures and seeing where they're at as early as 18. Younger, if you have other health issues like obesity, family history of diabetes, family history of hypertension, checking those things out. Because really, the recommendation for the American Heart Association and the American College of Cardiology, the ACC, really recommends that even if you're in your teens, if you have high blood pressure, get it treated because that damage is happening even then. And so reducing that now reduces your risk later on. And so that's one of those things that we just kind of see pop up, that patients will come in for something else. Like they'll come in because they've hurt their knee or some other issue, and we check their blood pressure and it's above that recommended 130 over 80, right? And they had no idea.
Yeah.
And so, we talk about it, and you know, there are some other things you can do for your blood pressure, like really reducing your salt intake, eating a balanced diet. But sometimes it's just genetic. It doesn't matter what you do, you really need medication. And again, patients are in charge of their healthcare, but I think a lot of patients don't understand the risks that's happening because they don't feel it. They don't know it. It also affects your vision, right? You get that vision change as well.
Well, I'm glad that you touched on that too, is that some conditions can be managed alternatively besides medication, right? Like changing your diet, changing your exercise.
Yeah. So, of course, the cornerstone of any healthy outlook to patients is diet and exercise. We know that that fixes or helps or reduces so many other diseases, chronically and even little things, right? So, like we were talking about knee pain. I don't know why I keep bringing up knee pain, but for patients that it's not an injury, right? But staying active really reduces the risk of getting those injuries later on. And so, and then of course being at a healthy weight and what that is for you is always a
Yeah.
conversation. But
Yeah. Well, those are just touchy conversations, but they're important to have with your healthcare provider. So, what services or programs do you wish people took more advantage
I
of?
think so. I had a patient, he's in his 40s and he's never been to a primary care provider. He's
Ever.
never seen a doctor. And so, and I saw him outside of the clinic first. That's where I met him at. I ran into him and he's like, well, I don't know how to get started. I don't know how to get started with that. He's like, do I go to the ER? And I was like, and so we had a conversation and I didn't realize that people didn't know that. That just seemed because I grew up with going to doctors,
Hmm.
right? You generally do that. And not everyone gets that as they're younger. And so they don't know how to do that. And so really just, and I was like, no, all you gotta do is just call the clinic and make an appointment. It's so easy and then get started. And he was like, I didn't realize it was so easy. I
Yeah.
was like, it really is, but he just didn't know how to do that. He didn't know how to pick a doctor or a provider.
Yeah.
And I was like, you don't have to, right? Let us do that for you. So, um,
And I don't think that's really an uncommon problem because I know when my daughter went to college, she called me and she's like, "How do I make a doctor's appointment?" Because, sometimes your parents just take care of that stuff for you. So that's a good life skill, I think, maybe scheduling your own doctor's appointments. It's kind of scary still as an adult, too. You're like, what's your insurance? Has it changed? Maybe. I don't know. Yeah, exactly. Yes, they do.
so the answer to your question about things like that. So there's actually a lot of resources in our community that don't get taken advantage of. I mean, I think living in a rural area, especially in the small rural areas, you don't have as many resources as bigger cities. But there are still resources here that don't get taken advantage of. We talk about public health and human services, and they have a lot of programs. They have a health eating class
Hmm.
that I think is really great that I don't think patients take advantage of. They have blood pressure monitoring. They help with diabetes. Riley at the pharmacy is a diabetic specialist, and he can help helping us manage your medications and your treatments and making sure that you know how to do your finger sticks correctly. And so really talking to people and letting us know what you're having an issue with or concern with so we can help you. And then of course, just the things that the clinics offer, right? We offer setting up those screenings we talked about. We do pap smears and those kinds of things, getting your mammogram done, which, is pretty common. I think patients are pretty up on that. They know about, I mean, with breast cancer research and the whole pink stuff and all that. I think people know about it, but I think people, like we talked about before we started, I think people sometimes forget how long it's been,
Yeah.
because people say, "Oh, it was like last year," and then we'll look and it's been 4 years since they've had one done. And so really just kind of keeping track of that. But there are a ton of resources that don't get used.
Yeah. And I think one of those resources too is just understanding your insurance because a lot of times insurance will cover many of those preventative screenings that people put off because they think it's going to be very expensive. And so, yeah, understanding your insurance so you know what services are available to you, I think is important too.
Yeah. Yeah. Preventative care was kind of a rule with the Affordable Care Act was preventable care has to be covered at 100%. That doesn't mean that all of your labs are. Insurances get really wonky about that, but the hospital offers the direct access testing labs, which is really affordable for patients who haven't met their deductible or who are going to meet their deductible or who don't have insurance.
Yeah, that's another great point is that if you do have to have labs here at the hospital, when you check in, ask about direct access testing because the pricing can be different from your insurance. And so on our website, we have more information about direct access testing. Because what direct access is that you pay out of pocket for the exam, and we have them all written down the cost of each one. So it would be up to you as a patient. This is again about taking charge of your health is to understand it if the out of pocket cost is more affordable than going through the insurance because as we all know insurance is complicated and sometimes really expensive.
And real quick, you don't just go in and order it. You can go in and get your own labs done.
So like I want to know what my A1C is.
Yep, you can go in, you pay for it, you get it done.
The difference is you'll get those results. They don't come to us. We don't see them.
Can I bring those results
Yes.
to you?
We want you to bring them to us. We want you to bring them into us so we can go over them and talk about that and make sure that you're not just getting lost. I had so funny enough, I actually had another provider who doesn't do primary care. She got her direct access testing labs done the other day and she asked me to look at them. She brought them in. She made an appointment. She came in. She's like, hey, I haven't done this stuff in so long. Can we go through them? So just bring them into us. We can go over them. We can talk about them. Make sure you understand what they actually mean. Because sometimes there'll be a lot of reds.
Mm.
They're abnormal. And some of those are a really big deal. And some of those don't always mean they are. So just talking to a provider before you start freaking out.
That's great advice. So, what kind of advice do you have for somebody that's maybe thinking about going into nursing or being a nurse practitioner?
Best career is honestly and I've done other things. I mean, I've managed restaurants. I used to work for United Airlines. We had tables, which is also a fun career, but nursing above all has been amazing. I think the best thing is just to get started. Just get started. Talk to your community college, and we have more community college right here. There's so many online resources now that we didn't have 20 years ago when I started. But yeah, just get started and look into doing it and seeing, go online. There's all kinds of resources online about, what kind of nursing is available out there and just start doing that. But as a nurse practitioner, truly being able to affect patients' care and outcomes and health, just at the end of the day, you're just like, I did that. I
Uh,
saw that, I caught that, I fixed that. I helped that patient understand their disease better that you don't get in any other profession.
That's awesome. What do you find most rewarding about serving this community?
So I think it's true about any rural healthcare, any provider who is involved and through that. I've lived here and been here since 2018, and really just getting to know my patients and seeing them over again and getting to know not just their health conditions, but who they are as people, what matters to them. Sometimes it really is, well, I just want to take care of my kids. Okay, but you should take care of yourself too. But really just getting to know like families and what's going on with them, I think is something you get in rural healthcare that you really don't get anywhere else.
Because do you take care of generations of one family?
Yes. So as a family nurse practitioner, we see everyone from newborn to geriatrics all across the lifespan there. And so really it is whole families you see.
To me, that would be probably the most incredible thing. Just seeing somebody born and grow up and then they have kids. I think that is very cool. So what's one thing you wish every patient knew before coming in for a visit?
The one thing that I really wish patients knew um, is that I wish they would bring in the list of medications and supplements that they're taking, the names of them, the dosages, how often they're taking them, and their allergies. Those two things get missed so much that if you come in and you've seen another provider or your new patient, if you bring in your medications, it helps me make sure that we're realizing, because sometimes patients will be like, well, I don't have hypertension because they're on hypertension medicines or high blood pressure medicines.
Oh,
And so their blood
yeah.
pressure is controlled. So they're like, well, I don't have it, but you do. Same thing with diabetes. That happens. I have patients who come in and they're like, well, I don't know medicines I take. Okay. Well, what chronic diseases do you have? Well, I don't have diabetes. Well, but they do, but because it's managed, they don't think about that.
Hmm.
And so really that one, make sure that we're not make sure you're taking the right medicines, making sure that we're not having interactions with medications, because that can be really important too, especially when you see multiple providers, because sometimes other providers will start different medications. And if I don't know about them, you may be having a risk of a serious reaction. But if I don't know all of your medications, I'm not going to see that. And so that's really that big thing. Bring your meds in, know your allergies, know your diseases. And then as a side note, family history would be great too.
And we do have these really cool little trifold medication cards that we have for free at the front desk in the hospital. And so if people are looking for somewhere to write that down, we do have these little cards that you can get anytime. Just walk into the hospital and ask for a medication card.
And keep it updated.
Do you have any final messages you'd like to share with our listeners?
Yeah. So I really the reason I signed up to do this was because I wanted to bring up preventative care. I think that, like we talked about a little bit already, it does get missed.
it does get missed a little bit. We know patients come in because they're coming in for a specific problem. Like they come in because they have the cold or the flu or strep throat or any of those things, or needing medications for that. And so that's the only reason they come to the provider, right? Where realistically the recommendation is yearly coming in and do a preventative care exam, going over, your diseases, making sure you're checking your blood pressure, making sure that we're not missing, immunizations. And I think when people talk about immunizations, they think, oh, well, I did those when I was a kid.
Yeah.
Right. Or I'm not doing that. Right. Again, you're in charge of your healthcare. You get to do what you want to do. But there are things that I think people don't realize or don't know when they're supposed to start them. Like we talked about colonoscopies at 45, mammograms, we start those basically at the age of 40. Right. And these are all, normal risks. If you have higher risks, of course, that changes, and you should talk to your provider about that. Family history can play a part of that too. But, doing your pap smear starting at 21, that's a big thing. And there's some new things coming out with that. That's going to make that a lot easier in the next probably 5 or 10 years. Because I know that can be problematic for a lot of patients because it is, I don't know. I think I've never had one, so that's not fair to say, but it seems pretty invasive. I think patients struggle with that a little bit. But doing like lung cancer screenings, right, for smokers. I think patients, they're like, oh, well, smoking is definitely causes a lot of issues, smoking and vaping. But there are, if you're doing it, we want you to stop, of course. But if you've done it for a while, then we know, let's get those things checked out and make sure that we're not missing something. Checking your PSA or your prostate, checking for prostate cancer, right? Those things are easy to do. We start that at 55. So, if you're above 50, you're getting labs done, get it checked. It's easy. It's just a blood test. So, and then, we talked about immunizations, the shingles vaccine, if you're 50 or over, getting that done. Shingles, if you've ever known anyone who's had it, it's awful. Yeah. It's painful. It can take a long time to heal. And so getting that vaccine, it reduces that risk of getting it. So, and it's a 2 series. It's not just one. Some vaccinations are 2 series. You have to do one and then later do another one. And so making sure you're getting both to be fully protected. The pneumonia vaccine is the same way. So there's 2 vaccines for pneumonia we need to get 2 of those. And then of course, your tetanus every 10 years, unless, you're at high risk or if you get a cut. Tetanus lives in dirt. And so anytime you're like, I have people who garden and they'll pick themselves on a something, right? Kind of a weed or a stick or whatever, they'll get that increases your risk, right? And so if you're doing those things, we really want to make sure that we're talking to your provider about how often you should be getting your tetanus shot, whether it be, every 10 years or every 3 years or whatever. And it's completely safe to do. We give it to pregnant women. Mm-hmm. So, those kinds of things. So really that's just kind of it. And then something else that we kind of skip over here a little bit in our community, just because I think patients think, well, I live in a small community and I don't have to worry about those things and everyone's good. But we actually have a lot of sexually transmitted infections that go around in our community. And I think just getting that tested, of course, if you have any symptoms, absolutely. But, we call it high risk behavior. But if you're having interactions with, in a non-monogamous relationship or more than one person, or, for whatever reason, just get tested. It's easy. It's a blood test. And so,
and I think that there's just like people are scared of those conversations. So, if I was worried about that, could I just make an appointment with you and not tell the person on the phone that that's what I'm after? And
absolutely.
Okay.
Yeah, absolutely. You can just say, I don't want to talk about it. Or what, be like, I just want to talk to them or any of that. Something else that we can talk about real quick. And, we absolutely want to talk to you about it. We want to talk about risks and what's going on and make sure that we're covering that. But you can do direct access testing for your sexually transmitted infection panel. You can come in and do that on your own. You don't have to come see us, but then bring those results in so we can talk about them. And if you are having high risk behavior, let's talk about ways to reduce your risks for that. Come in and talk to your provider. We want to be there for you. That's what we're here for. We want to make sure that you understand what's going on so that you can make an informed decision. We want you to, there's always this conversation about, Google searching or online care.
Yeah.
And I'm not going to say that it's wrong. There's some really good information out there, but there's also a lot of conflicting information. And when you search for things, there's no overseeing organization that says this is true or not. So you can get a lot of misinformation. And so if you're seeing something or you have something and you've searched for it, come in and talk about it. And I'm not offended if you say, hey, I was searching and I saw this, or I think I should be on this medication. Okay, let's talk about it, because maybe that is the right medication for you. And maybe it's really not because you're on something else. But don't just take that as the end all be all, because it really could be completely misinformation that's getting you the wrong path that could set you up for failure later on. Yeah. But so we do see that quite a bit. People are, everyone's on the internet, everyone's on computers all day long.
Oh yeah.
And so they're always just like, oh, well, I had a twinge in my eye or whatever. Yeah. And they're Googling it. What can that mean? And of course,
guilty.
And the first line is like, could be cancer. And it's generally not, but sometimes it is. And so, but we want you to come in and talk to us about it.
Yeah. And I think a lot of that, again, goes back to fear, because, like, we don't have any problem knowing that we need to change the oil in our car every year, or get new tires, or wiper blades, just like regular maintenance things that probably cost more than a doctor's visit. But I think it's just that people have just a innate fear of what could be, not only billing or, how much is it going to cost me, but like, what if there really is something wrong with me? It's just scary.
Yeah. Yeah. The bury your head in the sand treatment plan.
Yeah.
Yeah. That doesn't really work out so well.
Yeah. So it doesn't. So yeah, like step one, make an appointment and talk to your primary care
about it. Call Parke
it.
Health, call Stratton Medical Clinic. We usually have same day or next day appointments, depending on the provider you're seeing and their schedules. But, we're pretty easy to get into. So realistically, at the end of the day, it's just, if you have questions, if you have concerns, come see us, make an appointment, come talk to us, come, you don't have to come because you have a problem. It could be that, I have patients who come in because they have a family diagnosis of something and they don't understand it. And they'll come in and just be like, my brother-in-law was diagnosed with prostate cancer. What are my risks? So it's okay. We're here for you. We're always here. Just call, make an appointment, come see us. It's easy. Don't be afraid of us.
If you want to make an appointment, then you can check out our website, www.kccchsd, for all of our phone numbers and locations. And where you cannot schedule online, you can definitely have a lot of access to information, as well as, again, the phone numbers and locations.
Yeah. Thanks, Eileen.
Yeah. Thank you for joining us. Again, thanks for joining us here on the KCCMH Connection. Little teaser, we have a new provider coming to the specialty clinic in April. Yes.
So excited.
So, has something to do with the kidneys.
Yes.
Anyway, that will probably be our next guest. So thank you again, and see you next time.